Today we are going to talk about HPV and how we as healthcare providers can use vaccination to prevent cancer and decrease the spread of HPV in our patients. HPV remains the highest spread sexually transmitted infection worldwide. With a vaccine that can literally prevent cancer, why do infection rates remain high? And what can we as healthcare providers do to increase the health literacy of our adolescent patients and their families? By implementing small changes to our current practice, we can act as an advocate for our patients and prevent cancer. How amazing is that? Compiling research from Maryland's Immunet, only 3% of Garrett County adolescents who are HPV vaccine eligible are fully vaccinated against HPV. We fall far below the national rate of vaccination, which is around 58% of U.S. adolescents being fully vaccinated against HPV, according to the CDC. Nationally and locally, we are far below the targeted goal of 80% of vaccine-eligible adolescents being vaccinated, as laid out in the Healthy People 2030 goals. The CDC estimates that 90% of sexually active men and 80% of sexually active women have been infected with HPV at least once in their lifetime. Many people who are infected with HPV test positive in their late teens to early 20s. Most cases of HPV never cause any complications for the patient. However, complications related to HPV infection can range from genital warts to cancer. As clinicians, we should promote prevention in all aspects of our patients' health, including their sexual health. So why are we behind? To change how we approach HPV vaccinations, we must first discover the barriers to vaccine compliance. Parental vaccination hesitancy is the #1 reason that adolescents do not receive the HPV vaccine. Parents are often hesitant about the HPV vaccination due to the stigma and misinformation associated with this vaccine. Many people continue to believe that getting vaccinated against HPV infection promotes sexual promiscuity and early initiation of sexual activity. As many of us know from the recent pandemic, vaccine misinformation is at an all-time high and directly impacts healthcare decisions. Some people believe that HPV vaccines are associated with infertility, when in fact HPV infection is more often related with complications conceiving. Some parents do not realize that boys can also be vaccinated against HPV, that it's not a gender-specific vaccine. Cancers related to HPV infection are not just cervical cancers. Rather, 90% of anal cancers, 40% of penile cancers, and 70% of throat cancers are associated with HPV infection. Some studies have found that parents do not realize there is even a vaccine for HPV that prevents cancer. How astounding. The #1 reason parents decide to vaccinate their children for any disease is clinician recommendation. Because HPV vaccination is not a required vaccine for entry to Maryland schools, many families do not actively seek out vaccination. Vaccine compliance can also be an issue for many families, with the HPV vaccine needing 2 to 3 doses to reach compliance, depending on the age of the child at administration. Finally, breakdown in appointment reminders and social determinants of health, such as access to healthcare services and transportation, create barriers for families to reach compliance with their adolescents regarding their HPV vaccine. So now that we've identified the barriers to vaccination, we can explore solutions to these barriers. To be an advocate for your patients pertaining to HPV vaccination, it is important to develop an action plan. Any plan should begin with promoting education, improving health literacy, and encouraging autonomy in your adolescent patients. To educate others, you yourself must stay up to date on recommendations for HPV vaccinations. The CDC offers a wide variety of educational materials for parents, adolescents, and clinicians. These materials can be used to address vaccine questions and misconceptions. As clinicians, we love data. Tracking your practice's vaccination and refusal rates can influence your practice related to vaccine recommendations and administrations. Should you notice a trend in your adolescent patients not getting vaccinated against HPV, you can assess the barriers to vaccination and implement changes to your practice and the structure of your clinic. Studies suggest that discussing vaccine refusal at additional patient encounters can increase the chance of vaccine initiation. Just because a parent or patient refuses once does not mean that their opinions won't change. But if we never bring it up, we are denying them the opportunity to get vaccinated. We clinicians can also improve our communication techniques through further education and training to ensure that we are actively seeking opportunities to address vaccination status with our adolescent patients and their families, and are not hesitant out of fear of impacting our patient-provider rapport. To be successful in establishing clear, open communication with your patients and their parents, it's important to always have respectful exchanges. Establishing trust between the patient, their parents, and yourself as a provider will make having difficult discussions easier. As we've discussed, the HPV vaccine is often stigmatized. Parents have heard many misconceptions about this vaccine. When discussing adolescent vaccinations, bundling your vaccine recommendations shows the parents that the HPV vaccine is just as important as other school-required vaccinations. An example would be, Jake's 11 years old. Now is an important time to get him up to date on his vaccines, such as meningococcal, whooping cough, and HPV. As he gets older, these immunizations will provide him the protection he needs. Adolescents may have different feelings on the vaccine than their parents. It's important to promote autonomy for adolescents during this critical time of development, while allowing the parents to be a part of this conversation and this big decision in their child's life. Having open conversations with adolescents and their parents that encourages vaccination with the vaccine proven to prevent cancer will change the health of our local community. Gathering all of the information we've discussed, there are some interventions that have produced positive results in increasing the HPV vaccination rates in other clinics. Many practices utilize an electronic health record to provide their patients with the most up-to-date information related to their health status. Many electronic health records are equipped with the ability to set up reminders for appointments. These same capabilities can be used for vaccination reminders. Utilizing electronic media accesses the largest patient populations due to the prevalence of electronic devices in homes. Electronic reminders can come in the form of an app notification, email, text message, or automated voicemail. Patient navigators are staff members that can bridge the gap between electronic reminders and in-person visits. In one Texas clinic, patient navigators were medical assistants that called parents when their child became HPV vaccination eligible to set up appointments. If the parents expressed hesitation, the patient navigator set up the appointment as a counseling appointment. The patient navigator would see the patient and their parent first to discuss the vaccination. The patient navigator would then inform the provider about the conversation, and this would ease the transition for the provider to address the reasons for vaccine hesitancy. Many clinics cannot afford to take staff out of their current duties to fill a patient navigator position. However, implementing the principles of this program could be beneficial to your practice. Vaccination campaigns can be a great approach to increasing HPV vaccination rates in adolescents. Providing educational material in your office that is culturally appropriate to your patient demographics creates a level of relatability. Using a multimedia approach to include printed materials, take-home printed materials, electronic media, and social media can improve the rate of vaccine initiation and completion. Assessing the social determinants of health in your patient population can influence how your practice addresses vaccines. Collaborative practice with the local health department and the school system could be useful to create a vaccination campaign that comes directly to the student to ease the burden of transportation. The VFC program, a national program to vaccinate uninsured or underinsured or Medicaid eligible children, covers the HPV vaccination at no cost to the family. In conclusion, it is important as a healthcare provider that you are an advocate for vaccination against HPV in your adolescent patients. Encourage your adolescent patients to get vaccinated at 11 to 12 years old, along with their school-mandated vaccinations, to protect them before they are exposed to the most prevalent STI. Assess barriers that your patient populations encounter in initiation and complying with HPV vaccinations. Address vaccination status at each patient encounter, and do not let initial refusal impact how you address vaccinations. Hold open, honest dialogue with your patients and their parents to address vaccination misinformation and hesitancy. Track your vaccination data so that you can change your clinical practice to meet the needs of your patients. Use a multifaceted approach to ensure that patients are informed of the availability of the vaccine, the need for the vaccine, and the administration schedule for compliance. But most importantly, advocate for your adolescent patients to get vaccinated to stop the spread of HPV-related complications and cancers. Promoting HPV vaccination is cancer prevention. Thank you. I hope you found information in this presentation that can help you in increasing your confidence in addressing vaccination status with your adolescent patients at each encounter and interventions that could be implemented in your clinics that will promote vaccine health literacy.